Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. Now, today's topic is unexpected Medicare Part D cost. Now, just as a quick reminder, when you go on Medicare, Medicare is broken up into 4 parts, A, B, C, and D. When a person decides to stay in original Medicare A and B, A represents everything inpatient, B is everything outpatient. Now, some people decide not to stay in original Medicare, and they will get what's called a replacement plan or a C plan. These are called Advantage plans. So it's one or the other for in and outpatient care. Now, when it comes to drug plans, Part D plans, if you have an Advantage plan, they include that as part of the package. It's all in one. If I stay in original Medicare, this drug plan will be separate. And so today, when I'm talking about our Part D plans, whether it's embedded with the Advantage or it is separate from original Medicare, you can have unexpected costs. So we want to make sure that you avoid them. And there's actually 5 reasons I'm going to share with you today so that you'll know why unexpected costs occur and how you can avoid them. Now, the first reason why people have unexpected costs is because not all medications are going to be covered by Medicare. In fact, they tell us that Medicare covers about 95% of all medications that are on the market. Now, folks, there's not one plan that's going to cover all 95% of medications on the market, but Medicare says that there's only about 5% of meds that are not going to be covered. You just have to find a plan where those medications are going to be covered. But it could be that you're on a medication that is not covered by Medicare whatsoever, and that can be very surprising and very unexpected because maybe it was covered by your group plan or your individual plan, but there's no Medicare plan available that's going to cover that medication. So hopefully you can find some alternative or some equivalent to that particular medication. Again, not all medications will be covered by Medicare. Now, the second reason is not all medications are in, notice, your plan's formulary. In most markets today, there's somewhere between 20 to 30 different drug plans. And those drug plans are going to vary in their formulary. Basically, there are good formularies that cover about 3,000 medications. There are better formularies that are going to have about 5,000 meds that are covered in the plan. And then there's those that are best, and they're going to have about 7,000 medications that will be covered. And so what you must do is you have to do your homework or work with someone that is going to help you through this process because you want to make sure that your medications are in your formulary. Many times people just look at the premium that they have to pay for that particular plan. Folks, the premium is not the most important thing. The most important thing is the formulary. So you want to be sure that your meds are covered in your particular formulary because if not, you'll be out of pocket 100% of the expense of those medications until you get to change that particular drug plan. Now, the third reason for unexpected costs are a situation where you have a copay card. Now, copay cards are issued by manufacturers of medications. Pharmaceutical companies issue these, and they're almost always for high-cost medications. And the copay cards are usually very low. You have a copay card, you may have a copay of $5 for a $1,000 medication, or maybe a zero copay for a $250 medication. But what happens is once you go on Medicare, what you're going to see is almost always those copay cards are now going to be void. I wish that you could continue using those, but you look in the fine print of those copay cards, and almost always on Medicare, they're no longer going to be acceptable. The plan is no longer going to cover the rest of that cost other than just your copay. So now you're on Medicare, so it will go void. And so if that happens, you can be very disappointing. And so this also can lead to unexpected costs because you're getting it for $5 and now we go on Medicare and the price could be substantially higher. Now, the fourth reason is actually the most common reason, and that's this. We have surprises because of our out-of-pocket expenses or our copays can notice they can change throughout the year. Now, if you've been on an individual health plan or maybe a group health plan, you never had changes during the year. You had fixed copays throughout the year. But when you go on a Medicare plan, Medicare plans can change, which means your copayments can fluctuate in the same year. And that surprises people. So let me explain to you why copays can change throughout the year. See, every Part D plan, whether it's embedded within the Advantage or it's a standalone drug plan, is going to have 4 different stages, 4 stages, and each of those stages represents a different out-of-pocket cost to you. This is why they fluctuate. We start every plan off in the deductible stage. This year, the deductible on most plans is $435. And what that simply means is this. If you're paying copays for your medications, the copay is applied to the $435. It doesn't mean that you necessarily have to show up and write a check for $435. What it means, let's say I'm on 2 medications, and those medications have a $4 copay. So what are my medications costing me a month? $8 a month. If I have $8 a month copay, will I ever reach my deductible? And the answer is no, you won't. In fact, that's where most of you will be. You'll never reach your deductible. But let's say I'm on some brand name medication or maybe several medications. Eventually, I may reach the deductible. So if I ever reach it, what happens is then I go to stage 2, and now I have copays. And these copays are based upon the tiering of the medication. Every plan has 5 tiers, 1, 2, 3, 4, 5. The lower the tier, the lower your out-of-pocket copay will be. But here's what's happening that's different than any plan you've ever been on before, and that's this. While I'm in this stage, Medicare is tracking the actual retail cost. You're not paying the retail cost, but they track it. And if the total retail cost any time in the year will reach $4,020, and of course that's the 2020 number. This will go up a little bit in 2021 and beyond. But if we ever reach $4,020 retail, again, you didn't pay that. You actually paid a fraction of that, probably 10, 15% of that. And the plan you're on made up the difference. But if the retail total ever reaches that threshold, then we are done in stage 2. And now we go to stage 3, which is called the donut hole. And again, this is an unexpected jump in medications, because in the donut hole, what happens, instead of a low copay based upon tier, now I have to pay 25% of the retail cost of that medication. Right? And so we can jump from here to here drastically. Here, it could be a $45 copay. Here, it could be a $125 copay. And that leads to really financial surprises for people, because now we're paying the total retail cost of that 25% is going to be our particular copay. So that's a shocker many times. And then the last stage is called catastrophic coverage. And this one, by the way, is never disappointing. Everyone's happy here, because now our copay is only 5% of the retail. So now it's actually going to go down. But here's my point. We want you to realize that every single drug plan has these 4 different stages, and your copayments can fluctuate, oftentimes surprising people, especially they move from stage 2 to stage 3. And that takes us to the last reason why there are unexpected costs, and that's this: because you didn't read your annual notice of change. Folks, this happens all the time. Now let me explain the annual notice of change. The annual notice of change will be mailed to you right when the open enrollment period begins for Medicare. Medicare has an open enrollment period every year between October 15th and December 7th. This is a 7-week period of time. And any plan that you're on that's only written for 1 year, which are drug plans and Advantage plans, those plans have the right to change anything they want in that plan from year to year. And so they have to disclose to you what they're changing, and that's the purpose of this annual notice of change. So we call this the ANOC. And so what happens is they mail the ANOC to you right before October 15th, and we encourage you, open it up. Many people don't open up. You see, they assume because they like the plan this year, they'll like it next year. Folks, don't assume that, because you may be wrong. Because those plans have the right to change anything they want. They just have to disclose it to you. So that's why you open up your ANOC. And what you're looking for is this. You're going to look to see, have they changed my premium? And usually they don't change it much, but that can happen where there's a drastic increase. Actually, this year we had a plan go up 150%, but it happens. Number 2, I'm looking at my formulary. I'm going to make sure that all my meds are still covered. In other words, did they drop any of your medications? And that's why you got to open up to make sure your meds are still covered. And then third thing they can do is they can re-tier a medication. You may be on a medication 1 year, it's a tier 2, and they bump it to a tier 4. Or maybe you're on a medication that's a tier 3, and they bump it to tier 5. And when they make a tiering change, that can drastically increase your out-of-pocket copay. All right, and so that can be surprising. And so don't assume just because you like it this year, you're going to like it next year. Open the annual notice of change. See what they're doing. There's an 85% chance that you will like it, but there's a 15% chance that you will not like it because they've made a change, or maybe you've made a change to your medications and you actually need to get a different formulary. And so those are the 5 reasons why people have unexpected prescription drug costs. And I would encourage you, work with someone that understands this whole system and can make sure that you are on the prescription drug plan that is best for your needs. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School guides, call the number on the screen. See you next time.